Next week is the American Cancer Society's Great American Smokeout. If you've been trying to stop, now is your chance. If you need a reason outside of all the health factors, here's one. Quitting your pack-a-day habit would put about $3,000 back in your pocket each year. So how do you kick the habit? For today's Take Action Thursday, Dr. Tom Ingenio and Michelle Shaw with Mount Vernon Wellness join us this morning. Good morning to the both of you.
Good morning.
All right, so people try to stop smoking all the time and they just don't get where they're trying to go. What are some of the most common methods that people try?
Well, you know, we have a lot of over-the-counter methods like the patch or the inhaler or lozenges or gum. And I think because they're not getting additional support, either some counseling or support from their families, they tend to fail.
Okay. Alternative methods, that's what you're here to talk about and what you all do. Tell me about some of those.
Well, I'm a licensed acupuncturist, so acupuncture is the main modality that we use at our office. We also talk a little bit about behavioral modification. There are a lot of people that turn to hypnotism as well.
Ooh, sounds a little scary, but I've heard of that, a lot of people doing that. Why do those work where maybe some of the traditional methods don't?
You know, I think they're a way of tricking your brain into saying it doesn't need the cigarette. I think that's part of it. With an addiction, you're very hardwired for that chemical, and you need that chemical. But if we can change your brain, we can change how you crave the addiction.
All right, so Michelle is here. Can you show us one example of I guess, the acupuncture and how you would do that to get someone to stop smoking?
The protocol we use comes from the National Acupuncture Detoxification Association. It's actually used for heroin addiction. And it's been adapted for other kinds of addictions. It's great at stopping people from smoking.
All right, so what do you do?
Well, we need Michelle's ear.
Okay.
And this is called ear acupuncture, auricular acupuncture. For
how often would somebody have to do what you're about to do to her?
It depends on the person that is coming in for treatment. Some people are very, very addicted.
Okay.
And what they'll need is some regular treatments, about once a week for a while, maybe twice a week, depending on how the cravings go.
Okay.
What we tell patients at our office is after about 4 times, you should notice a significant reduction.
Are you feeling that, Michelle?
A little bit. There's a slight sensation.
Okay.
With the ear, because of the tissue, you know, this is cartilage, you tend to get a bigger pinch than you would with other areas.
All right, well, we're going to let you keep doing that, but we need to take a break. And then right after the break, Dr. Ingenio is going to be back to answer some of your calls about how to quit smoking. If you have questions, our phone lines are open now at 410-481-4545. You can also send us a tweet at Fox Baltimore or go through our Facebook page. You're watching Fox 45 Morning News, all local, all morning.